It is, of course, a much different story and a tragic one in India. They are seeing the very worst of the COVID-19 pandemic right now. Hospitals there treating patients in ambulances amid the shortages of both beds and oxygen. And today, India reported more than 412,000 COVID-19 cases and almost 4,000 deaths as well. The WHO said last week India accounted for nearly half of the COVID cases worldwide and a quarter of the deaths. As we know, that virus has already started to mutate and travel to the United States. The new variant has been detected, as we talked about, in Colorado. So joining us now is our 9 Health expert, Dr. Payal Kohli. Let's talk about the impact that the crisis in India is having. It is not halfway around the world. It is impacting us here in the United States and in Colorado.
Exactly right, Tom. Very sobering to see what's going on in India. And it really does teach us that this is a global pandemic. We can't declare victory here in the United States in isolation. And just like that variant from India got on a plane and came here, if this keeps raging on in India the way that it's going, a new variant may emerge, get on a plane and come here, and that new variant may be resistant to the vaccines, which could, cause a big setback here in the US. So we have to pay attention to what's going on, even though it's thousands of miles away.
Well, around the world and here in the U.S., for a year now, we've seen and talked about travel restrictions. President Biden has shut down travel to and from India, with the exceptions for American citizens with permanent residence, also with a negative rapid test. What do you think about the approach? Have we seen that be effective so far?
I'm very skeptical of the approach, to be entirely honest with you, because number one, we know that rapid tests are less sensitive in general at detecting virus, especially virus that's gone into your lungs already, moved away from the nose and gone into the lungs, so later on in the course of the illness. Number two, the FDA earlier this year in January actually issued a warning saying that in the face of these new variants, even the PCR tests, the nasal swabs, may be giving us more false negatives, because depending on what part of the virus the test is looking for, if the variant or the mutant has that part mutated, you may not detect it on the test. So the idea of letting people in from a country where the cases are so high using a rapid test, to me, is a little bit dangerous, and I think we ought to be careful. That's how the virus came here, and it's going to continue to come if we don't start being more thorough.
So you mean a travel ban should be ironclad? That if you're going to have a travel ban, have a travel ban?
That's exactly right. I mean, it doesn't distinguish. The virus doesn't check whether you're a citizen of the United States or a green card holder. It's just as likely to come from those people. Or we ought to do more thorough testing, including genomic testing, keep those people isolated for a good period of time, and then let them in. But using a rapid test is not a good idea, in my opinion.
Well, the U.S. and many countries in the world are now trying to help in India, and it's not only philanthropic. It could impact how long the pandemic lasts around the world. The CDC, though, is projecting that the worst of the pandemic in the U.S. could be over by July. I want to get your thoughts on that projection and how India may play a big role in that.
Tom, incredibly encouraging to hear this. And I think it's really symbolic of the fact that for the first time in so many months, a model has come out actually portending something positive and a turning point in our fight against this virus. So I was really happy to actually see that. But as you point out so rightly, that if India and other countries, Brazil and others, continue to have emergence of these infections and these variants, it may offer us a giant setback. So in order to sort of continue along the trajectory that we have set here in the United States with the number of vaccinations that we've achieved, we have to be sure we continue to get at least 2 to 3 million Americans vaccinated every day. And that's how we're going to make this model a reality.
All right, Dr. Payal Kohli, always good to talk with you. We'll keep an eye on things. Thanks again for joining us.